So, welcome everyone. I'm really happy to be here. My name is Nima Jokilakso, and I'm here to present Dr. Maombi. So, what we're interested in doing is to bring healthcare access to the big masses of people living in rural areas, mainly in developing countries. So, I want you to meet Abasi. He's a young boy living in rural Tanzania. Problem with Abasi is that he's being ill. He's sick, and he needs to go to a doctor. But the problem is that although he has the right to visit a doctor, there is no doctor nearby. And traveling to the big city with his mom is really expensive. So this is pretty much the problem in many developing countries. You have a big population living in the rural areas, and you have the doctors living in the big cities where they have the hospitals. So this is where we come in. And this is what Dr. Maombi do. This is a mobile healthcare application to connecting patients in the rural parts of the world with the doctors in the hospitals. How does this work? Well, first of all, it's not going to be the patient themselves doing this test. It's going to be trained healthcare workers, although not doctors. I mean, we're talking about nurses, community healthcare workers that will use this app on a smartphone to take photos of affected areas and also to describe the symptoms and write down the patient information and medical history. And then by doing this, they can press the send button, send all this information to the doctor located in the hospital, who will do a triage to say whether this patient needs to get into the big city hospital or can go home for monitoring.
All right, so my name is Daniel. I'm the lead developer. And for this hack, we basically skipped all the hard parts with server management and connectivity and everything. So we actually use Dropbox, which allows us to upload files and sync files and everything. So no databases or anything, just a web app and a smartphone app. And that's all that's needed, basically. Right, Nima? Yes. And we actually launched the first field tries for in Tanzania, together with some partners, and we're constantly uploading new features for them to use. 30 seconds. I think we're done. Yes. Or maybe we can add stuff. So we're not alone in this. It's me and Nima, of course. We also have Jesper, Lisa, and another guy named Daniel. And these are our local representatives in Tanzania right now. Thank you.
Good that you have a team slide. That's usually one of the most important things. If this was a venture capital pitch, who are you? What have you done? Oh, you're a PhD. That's interesting. So I think that's a very good thing. The one thing I didn't understand really: who is gonna take this kid's information or condition and get it to the doctor? Will it be somebody who's an aid worker in the village, or?
Yes.
Okay.
So that's the nurses and the community healthcare workers, people with a medical training, but although very limited such.
But is it a photo of
symptoms? So you take photo of symptoms, but most of all you write down the patient information, because even the nurse can do a lot of assessments, but they have a lot of the times not the authority or the expertise to make a lot of decisions based on just these symptoms. So they would like to have a second opinion, and that's what they get from this doctor then.
Pictures, you can take movies, you can take voice recordings, and everything is uploaded to an off-site doctor with time and experience.
Also, we have a working app here that we can show off the demo if you're interested in seeing it.
Cool.
I think it's cool that you have a team and you seem to be pretty impressive. You all have an app already. My question is, this is an hackathon. What did you do? What was your hack?
The hack, what we did for the last part was adding voice recording, and actually started to, what's it called, when you process the sound files to extract keywords. So we can actually transcribe it and make it searchable and for a database, because that's the next move, to move all this out of Dropbox and into a more secure server.
Cool. Thank you.
Thank you.